Welcome back to the deep dive. Today we're jumping into something pretty important, maybe even a bit frustrating for some of us, medical testing.
Yeah, it's a big topic. Tests are, well, obviously essential tools, right, for diagnosis, monitoring, all
Yeah,
that.
totally.
But the sources we looked at also show this other side, where patients sometimes get tests they don't really need.
And that's what we want to unpack today. Sort of our mission for this deep dive is figuring out why that happens, what the downsides are beyond just, the hassle, and crucially, how you, listening, can maybe navigate this better.
Right. We've got material here looking at the problem itself, some really practical advice, and also the bigger picture, like organizations focused on quality in healthcare.
Okay, let's get into it. What are these sources telling us? So first off, the problem. The sources seem pretty united on this. Tests are vital, yes, but, doing too many, or maybe the wrong ones, that can actually cause problems, not just be inefficient.
Absolutely. It's not just about wasted effort. There are real downsides.
Like what? What are the big ones they highlight?
Well, the obvious one is cost, right?
Yeah.
Tests cost money, sometimes a lot of money, and repeating them, that adds up fast for you, for the system.
Sure, the financial hit. That you said it goes beyond the wallet.
Yeah, definitely. The sources talk about physical risks, like radiation exposure from CT scans or other imaging.
Okay.
Or complications from more invasive tests, things like infection, bleeding. They might be rare, but it's still a risk. And you wouldn't want to take that risk if the test wasn't really justified.
No, absolutely.
Yeah.
Avoid risk if there's no clear gain. Makes sense.
Exactly. And another major thing, maybe less obvious, is the confusion factor. Getting, borderline or slightly weird results from a test that wasn't strictly necessary.
Yeah.
That can kick off what some sources call a diagnostic cascade.
Right, the cascade effect, where one maybe insignificant result leads to another test, then another.
Precisely. And you end up going down this rabbit hole, maybe getting treatments you didn't need or just dealing with a ton of anxiety and stress.
Wow.
One source put it really well, I thought. It said, more tests don't always mean better care. Smart testing does.
Smart testing does. I like that. Simple, but says it all.
It's about being targeted, not just throwing everything at the wall.
Okay, so if smart testing is the goal, why does the other kind still happen? Why the unnecessary tests? What reasons did the sources give?
It seems to be a mix of things, really. No single cause.
Like?
One common one is just information gaps.
Yeah.
Like not having easy access to your previous test results.
Oh, right. You had to scan somewhere else or you just forgot the paperwork?
Yeah, exactly. Or maybe the results are stuck in another clinic system. If your current doctor doesn't know you had a perfectly good test recently, they might just order a new one to be sure.
That seems fixable, hopefully. What else?
Sometimes it's a doctor's preference for a specific lab. Maybe they trust the results more, or it's faster, even if you have a valid result from somewhere else.
Okay, so logistics, preferences. What about the actual decision-making? The pressure on the doctor?
That's definitely a factor mentioned. This idea of defensive medicine. Meaning doctors ordering tests partly to cover themselves, legally speaking, to rule out every tiny possibility, even if it's really unlikely, just to avoid missing something and facing a potential lawsuit later.
So being ultra cautious, which you can understand from their side, but it leads to more tests overall.
Exactly. It's often well-intentioned, trying to be thorough, but it can tip into over-testing. And then, less commonly maybe, but the sources do mention it. Sometimes there are financial incentives in certain setups that might encourage ordering more tests.
Right. So information gaps, caution, maybe some system incentives. It's complicated.
It really is.
But we need to be clear. Tests themselves aren't bad. They're crucial when they're actually needed. When do the sources say tests are clearly necessary?
Oh, absolutely. Foundational stuff. Like when you have new symptoms, tests are key to figuring out what's wrong, getting that diagnosis.
Makes sense. And if you already have a condition?
Then they're essential for monitoring it. Checking if treatment is working, tracking things like blood sugar for diabetes, or seeing if a chronic condition is stable or changing. It gives objective data.
Okay. What about preventative care? Screenings?
Yep, that's another big one. Routine screening based on your age, your gender, family history, specific risk factors like high blood pressure. Those tests catch things early. Super important.
And before surgery or certain treatments?
Yeah, pre-op tests or tests needed before specific therapies, those are crucial for safety, making sure you're fit for the procedure.
Okay, so tests are definitely powerful allies when used right. Which leads us to, what can you do? How can you as a patient help avoid the unnecessary ones. The sources had some practical tips, right?
They did. And this is where it gets really empowering, I think. The core idea is basically becoming the manager of your own health information.
Your own data steward.
Kind of, yeah. Like, always try to carry your previous reports, physical copies, maybe photos on your phone, or keeping a dedicated health file like one source mentioned.
So if you have that recent report right there.
Exactly. It might mean the doctor says, oh, okay, we don't need to repeat that. It directly prevents duplication.
That's huge. Simple, but huge. What else?
Be prepared to ask questions. The sources really push this. Don't just nod along. Ask why a test is being recommended.
Like, what are we hoping to find out?
Yes, and is it urgent? Could we use my last report instead? And a really good one is, how will this result actually change my treatment or management plan?
Ooh, that's a key question. If the answer is, well, probably not much, then maybe you push back a bit or ask if it can wait.
Precisely. Understand the impact and also understand the risks we talked about earlier, the radiation, the potential complications. Make sure the benefit of the test clearly outweighs any potential harm.
Okay. And what if you're just unsure? Maybe the doctor recommends a whole battery of tests. Some sound expensive or invasive.
The sources are clear. Getting a second opinion is perfectly normal and often a really good idea, especially if you're feeling uncertain about a lot of tests. It just gives you another expert perspective.
Good to know. That's encouraged. Anything else on the do list?
Yeah, be a bit wary of, like, package deals or screenings offered out of the blue, maybe by clinics just trying to get business. Ask if every single test in that package is relevant to you personally.
Right. Don't just buy the bundle without thinking.
Exactly. And remember, informed consent. That's your right. You can say no to a test if you don't understand it or feel it's not needed after you've discussed it with your doctor, of course. Ask for clarification until you feel comfortable.
And cost. Should you bring that up?
Absolutely. Discuss the costs. Ask if there are maybe less expensive but still effective alternatives. Being aware of the financial side is part of being an informed patient.
Okay, so those are I guess the don'ts are pretty much the reverse.
Pretty much, yeah. Fundamentally, don't just agree to everything without asking why.
Makes sense.
Don't doctor hop without sharing your full history and all your previous reports. The sources really flag this as a major cause of repeat testing.
Ah, yeah. Each new doctor starts from scratch if you don't tell them.
Exactly. And don't throw out old reports too quickly. Even something that seems minor from a few months ago might still be relevant. Keep that file.
Okay, so it's a lot about being organized and asking questions, but this isn't just happening in a vacuum, right? The sources also talked about the bigger picture, the healthcare system itself.
Right, yeah. This whole issue ties into broader efforts to just improve healthcare quality and safety overall.
How so?
Well, there are organizations whose whole job is to set standards, like Joint Commission International, JCI. They work globally in loads of countries, setting these really rigorous benchmarks for how hospitals and clinics should operate safely and effectively.
Okay, so they're setting the quality bar internationally.
Exactly. And then you have national bodies, too. Like in India, there's NABH, the National Accreditation Board for Hospitals and Healthcare Providers. They're part of the Quality Council of India, and their goal is similar, but focused domestically, creating this sort of ecosystem for quality.
So these groups define what good looks like. But how do hospitals actually meet those high standards? It sounds like a lot of work.
It is, and that's where you sometimes see specialized consultants come in. Firms like CU39, which was mentioned in the material we looked at.
What do they do?
They basically help healthcare organizations navigate the whole accreditation process, like getting ready for NABH standards. They offer support with planning, operations, that kind of thing.
And interestingly, the sources specifically noted that these consultants, like CU39, actually address how to avoid duplicate or unnecessary tests as part of that quality improvement support.
Yes, and that's a really key connection. It shows that tackling unnecessary testing isn't just something patients need to worry about. It's recognized at the system level by these quality organizations and the people helping hospitals meet standards as being fundamental to high-quality, efficient, safe care.
So it's part of the definition of quality now.
Seems like it. And of course, the doctors and hospitals themselves are crucial. They need to be mindful, use evidence-based guidelines. One source pointed towards resources like the Journal of the American Medical Association for that weigh the benefits and risks and really involve patients in the decisions.
Okay, so let's try and wrap this up. If we boil down everything we've discussed from these sources, what's the main takeaway message about medical tests?
I think it really comes down to partnership. You, as the patient, need to be an active, informed partner in your own healthcare journey when it comes to testing.
Meaning?
Meaning, understanding why tests can be overused, knowing when they're truly essential, and then using those practical strategies we talked about, carrying your reports, asking those key questions. Why this test? How will it help? That really empowers you.
And the payoff for being that empowered patient.
Well, it can save you money, definitely. Save you time. Reduce a lot of stress and anxiety. But maybe, most importantly, it protects you from those unnecessary risks. The radiation, the complications. It helps make sure the tests you do undergo are the smart ones, the ones that genuinely lead to better care.
Yeah, it really seems like being proactive, being informed about tests, it's not about being difficult. It's about improving your own healthcare experience and outcome.
Exactly. Keep your records, ask why, understand the quality efforts happening behind the scenes. It all helps you navigate things better.
It's about making sure every single test has a clear, beneficial purpose for you.
Well said.
All right, so here's something to maybe chew on after this deep dive. We see these big organizations, JCI, NABH, setting standards for high-quality care, and those standards include cutting down on unnecessary tests. And we see consultants helping hospitals put processes in place to meet those standards. So if all these pieces are moving in that direction, what does it suggest about where healthcare might be heading? Are we slowly moving towards a system where maybe every test decision is automatically evaluated not just for clinical need, but also as part of a bigger strategy for efficiency and patient safety? Is that the end game?